Join me now, Harvard physician and former White House senior director for global health security and biodefense under Joe Biden, Dr. Raj Panjami. Doctor, it's so good to see you. And just watching part of that interview again, where Means called it just a couple of cases. But the CDC says it's now more than 24,000 cases across 47 states, including 2 deaths in Michigan. And now we also have this salmonella outbreak. Why is this administration dodging questions about these outbreaks?
Well, Kara, we've had the largest outbreak of cyclospora on record, in fact. And you mentioned the salmonella food outbreak. We've also seen more measles in the last 2 years than in the prior 2 decades combined. So this is not normal. I'm saying that as a physician and epidemiologist, but also for the many families out there that are feeling this isn't normal. It isn't. We have multiple outbreaks, some of the highest cases on record. Why? These can look like separate events. It turns out they're not. They're symptoms of the same thing. And the common cause, Kira, is a public health system that's been weakened because of funding cuts and because public health officials have lost trust with Americans.
You know, you mentioned cuts. We know there were staff cuts at the FDA, food inspectors included in that. Do you think that's playing a role here in these outbreaks?
It doesn't help, right? We've cut the very players we need on the field when the opponent, the viruses, the pathogens are coming at us. And federal health officials, whether it's food safety experts at the FDA, as you note, or disease detectives at the CDC, are the ones who work with local health officials to identify cases, pin down the cause, and recommend the fix. Fewer of them quite simply means a slower alarm bell. And, if we've learned anything in an outbreak is that speed is everything. And every day you're late to detect, every day people stay confused about the actions they can take to protect themselves, the harder it is to contain and the more people are exposed.
Point well made. All right, let's talk about the president's executive order on the childhood vaccine schedule. The administration now recommending that the MMR vaccine be split into 3 shots. Is there any scientific rationale for separate vaccines, Raj?
There isn't. The executive order calls for, let's unpack it. So split shots, you mentioned, this is for the measles, mumps, and rubella, or sometimes known as MMR vaccine. This is something that children take to prevent those 3 diseases, which can harm them quite significantly. The executive order calls for 3 separate shots instead of 1 combined one. Here's the challenge with that. First of all, those separate shots aren't available on the market, and the manufacturers say that it might take several years, if not longer, before they are available. But let's say they were available today. Many parents who are, like me, multitasking, wouldn't be able to take their kids to the doctor over and over for split up shots like this. And that's been proven in some other countries when such efforts have had to have been put in place. And what that means ultimately is some kids will go unvaccinated, some will get sick, and often it will be vulnerable families, Kira, who say can't afford a bus fare to get their child to the clinic or just can't afford to take the time off work again to go get that extra shot. So this is making vaccination harder, and when we need to make it easier. At the very time, as I mentioned before, we have more measles cases than we've had in over 3 decades.
Yeah, it's pretty scary. And when you look at all of this, the vaccine order and the outbreaks, I mean, Raj, who can people trust in this moment, just for reliable baseline information?
Well, one of the key things to remember is you don't need control over the whole situation to feel steadier. And this is something I would tell my patients and their families. What you need control over is the next meaningful step. And every outbreak starts in communities, it ends in communities. We can take that meaningful step for each of these threats. So for measles in particular, many of us are sending our kids back to school in the next few weeks. It's important to ensure they're up to date on vaccinations, including MMR vaccines, which are still available. So you should get it if you're due. And then more frequent contact with your physicians. You asked about trust. It turns out even in the latest polling, about 80 to 90% of Americans still trust their own doctor. Having more frequent contact with them is going to be critical, and they can help you cut through the noise because it is their job to weigh the evidence so you don't have to.
Dr. Raj Panjami, so good to see you. Thank you so much, Raj.
Good. Thank you, Kara.
You bet. And coming up in October, you can actually check out Dr. Panjami's book titled Safer: Turning Fear into Action and Crisis into Community.